Hey everyone! Welcome to Coding Doctor, your new home for mastering medical coding with clarity and confidence. I'm excited to have you here as we begin your journey into the world of medical coding. Whether you're just starting out or strengthening your foundation, this session will guide you step by step through essential ICD-10 concepts with clarity and confidence. So relax, get ready to learn, and let's make medical coding simpler, smarter, and more enjoyable. Together. Welcome to the class. Welcome to the ICD-10 Beginner Masterclass, your simple and step-by-step guide to understanding three of the most essential coding areas: hypertension, diabetes, and Z codes. If you're a new medical coder, this session will help you build a strong foundation. We'll break down common mistakes, teach you the logic behind ICD-10 structure, and walk through real-world documentation examples, all in an easy and beginner-friendly way. So, let's begin our journey into ICD-10 coding and make these complex codes simple, clear, and fully understandable. Why ICD-10 coding is necessary. Before we learn hypertension, diabetes, and Z codes, it's important to understand why ICD-10 coding matters so much in healthcare. First, ICD-10 ensures precise documentation and accurate diagnosis. It captures specific clinical details, improves data quality, and creates a clear patient history. This level of detail helps providers deliver more targeted and effective treatment. Second, ICD-10 is essential for accurate billing and reimbursement. Good coding reduces claim denials, ensures correct payment, and strengthens the overall revenue cycle. In simple words, correct codes mean smoother billing and fewer audit issues. Third, ICD-10 plays a major role in global health and research. It helps track disease patterns, supports clinical studies, and enables public health monitoring. Because ICD-10 is used internationally, it allows data comparison across the world. And finally, ICD-10 improves patient care. Better documentation leads to better treatment planning, continuity of care between providers, and stronger clinical pathways. It even helps predict outcomes and manage long-term conditions more effectively. So ICD-10 isn't just about coding. It's about accuracy, quality, and smarter healthcare. Now, let's bring everything together by looking at why hypertension coding matters so much. Because uncontrolled blood pressure affects nearly every organ system in the body. Starting with the brain, high BP can lead to stroke, dementia, and long-term cognitive decline. This is one of the most dangerous and common complications. Next, the heart. Hypertension is a major driver of heart failure, coronary artery disease, and even heart attacks. This is why accurate coding of heart involvement is so important. Moving to the kidneys, chronic high blood pressure causes CKD and eventually kidney failure, often requiring dialysis. This is exactly why we have an entire I-12 and I-13 coding category. Then we have the eyes. Hypertension can damage retinal vessels, leading to retinopathy, vision loss, and even blindness if untreated. And finally, the blood vessels. High BP weakens vessel walls, increasing the risk of aortic aneurysms and peripheral artery disease. All of these complications tell one clear story. Managing blood pressure and coding it accurately saves lives. So remember, manage your blood pressure and code it right. ICD-10 codes for hypertension. Now that we understand why ICD-10 is essential, let's begin our first major topic, hypertension coding. This is one of the most common areas in medical coding, and getting it right builds a strong foundation for beginners. ICD-10 divides hypertension into several categories, each based on the cause and the presence of complications. First, we have essential or primary hypertension, coded as I-10. This is the most frequently used code when no secondary cause is documented and there are no associated heart or kidney conditions. Next is secondary hypertension, coded under I-15. This is used when hypertension is caused by an underlying condition such as renal disease. For example, hypertension due to kidney disorders falls under I-15.0. We also code hypertensive crisis separately under I-16, which includes hypertensive urgency and emergency, conditions requiring immediate medical attention. Then we have combination codes for hypertensive heart and kidney disease, which fall under I-11, I-12, and I-13. These codes are used when the provider clearly documents hypertension with heart involvement, kidney involvement, or both. And finally, for pregnant patients, hypertension is never coded with I codes. Instead, we use the O10, O13, and O14 series to capture chronic hypertension, gestational hypertension, and preeclampsia. Understanding these categories is the first step in mastering hypertension coding. Essential hypertension, I-10. Let's take a closer look at the most commonly used hypertension code, I-10, essential or primary hypertension. This is the default code used when the provider documents hypertension without any complications or related conditions. Use I-10 only when hypertension is documented without any type of heart disease, any stage of chronic kidney disease, or any hypertensive crisis terms like urgency or emergency. If any of these are present, we must move to the I-11, I-12, I-13, or I-16 categories. Now, what terms are automatically captured by I-10? This includes a variety of common phrases used in charts such as high blood pressure, HTN, hypertension, benign hypertension, malignant hypertension, and even unspecified hypertension. All of these map directly to I-10 as long as no complications are documented. So remember, if the chart only mentions standard hypertension with no mention of the heart, kidneys, or crisis, your safest and most accurate code is I-10. Hypertensive heart disease, I-11. Next, let's look at hypertensive heart disease, which falls under the I-11 category. This code is used only when both hypertension and a heart condition are documented together. The provider must clearly document hypertension and a form of heart disease, such as cardiomegaly, left ventricular hypertrophy, LVH, congestive heart failure, CHF, or any other related cardiac condition. Now, once both conditions are confirmed, the next step is to check whether heart failure is present. If heart failure is documented, whether it's systolic, diastolic, or combined, we assign I-11.0, hypertensive heart disease with heart failure. In addition, remember to code the specific type of heart failure separately from the I-50 category. If the provider documents hypertension with heart disease but no heart failure, then the correct code is I-11.9, hypertensive heart disease without heart failure. In summary, I-11 requires two things: a documented heart condition and a clear link with hypertension. Without both, you should not use I-11. Hypertensive chronic kidney disease, I-12. Now let's move on to the next major hypertension combination category, hypertensive chronic kidney disease, coded under I-12. Just like the previous slide, I-12 codes are assigned only when both conditions are documented: hypertension and chronic kidney disease at any stage. The key thing to remember here is the severity of CKD matters because it determines which I-12 code you should select. If the provider documents CKD stage 5 or end-stage renal disease, you will assign I12.0, hypertensive CKD with stage 5 or ESRD. And remember to add the CKD stage code from the N18 category as a secondary code. If the provider documents CKD stage 1 through stage 4, or if the stage is unspecified, then the correct code is I12.9, hypertensive CKD with CKD stage 1 through 4 or unspecified stage. So the rule is simple. Both conditions must be present, and the severity of CKD determines whether you choose I12.0 or I12.9. Now let's quickly review CKD staging, which is extremely important when coding hypertension with kidney disease. CKD stages are based on GFR, the glomerular filtration rate, and this number tells us how well the kidneys are functioning. Stage 1 means a GFR of 90 or more, which indicates normal kidney function, but with some evidence of kidney damage. Stage 2 is a GFR between 60 and 89, showing mild kidney damage. Stage 3 drops further, GFR 30 to 59, and this is moderate CKD. Stage 4 is more serious, with a GFR between 15 and 29, classified as severe CKD. And finally, stage 5 is when GFR is below 15, where the patient is in end-stage renal disease, also known as ESRD. These stages are crucial because they directly impact ICD-10 codes like I12 and I13, so always look for the GFR value or the CKD stage in the documentation. Hypertensive heart plus CKD combination codes, I13. Now we come to one of the most important sections of hypertension coding, the combination codes under I13, used when a patient has both hypertensive heart disease and hypertensive chronic kidney disease. Remember, I13 codes are only used when both conditions are documented together. Hypertensive heart disease, hypertensive CKD. If only one of these is present, you cannot use an I13 code. Let's break down the I13 category. I13.0 is used when the patient has hypertensive heart disease plus CKD stage 1 to 4 and no heart failure. I13.10 is assigned when there is hypertensive CKD stage 5 or ESRD, again without heart failure. I13.11 is selected when the patient has heart failure and CKD stage 1 to 4. In this case, you must also code the specific type of heart failure from the I50 category. I13.2 is used when both conditions are present, along with heart failure and CKD stage 5 or ESRD. Two important reminders. The CKD stage must always be coded separately from the N18 category. If heart failure is present, the type of heart failure must also be coded separately using I50 codes. So I13 codes give you a complete picture, combining hypertension, heart involvement, and kidney staging, all in one structured way. Secondary hypertension, I15. Next, let's talk about secondary hypertension, which is coded under the I15 category. Secondary hypertension means the patient's high blood pressure is caused by another underlying condition, so it's not primary or essential hypertension. You use I15.x only when the provider clearly documents a specific cause for the hypertension. Some of the most common causes include renal artery stenosis, various kidney diseases such as CKD, glomerulonephritis, or polycystic kidney disease. endocrine disorders, including Cushing syndrome, hyperaldosteronism, and thyroid disorders, and drug-induced hypertension, which can occur due to certain medications. The golden rule here is always code the underlying cause along with the I-15 code. This means you must assign two codes, one from the I-15 category for the hypertension and another code for the medical condition that caused it. So secondary hypertension tells you that the hypertension isn't the main problem. It's a result of another condition, and accurate coding helps capture the full clinical picture. I-15.X code breakdown, secondary hypertension. Now that you understand the concept of secondary hypertension, let's break down the I-15.X codes one by one. This helps you choose the most accurate code based on the specific underlying cause. I-15.0, renovascular hypertension. Use this when hypertension is caused by renal artery stenosis, occlusion, or fibromuscular dysplasia. These conditions reduce blood flow to the kidneys, leading to elevated blood pressure. I-15.1, hypertension due to other renal disorders. This includes hypertension caused by CKD, polycystic kidney disease, glomerulonephritis, or hydronephrosis. Anytime the kidney disorder other than renovascular disease is responsible, this is the correct code. I-15.2, hypertension due to endocrine disorders. Select this when conditions like Cushing syndrome, primary hyperaldosteronism, thyroid disorders, or pheochromocytoma are driving the hypertension. I-15.8, other secondary hypertension. This is used for less common causes, including drug-induced hypertension, where any rare underlying conditions not covered in I-15.0 to I-15.2. I-15.9, unspecified secondary hypertension. This code is used when the provider clearly states it is secondary hypertension but does not document the cause. And here's the most important reminder. Never code I-10 together with secondary hypertension. If a cause is identified, even if the cause is unclear or unspecified, you must remain within the I-15 category. Understanding these subcategories helps you code secondary hypertension with precision and accuracy. Hypertensive crisis, I-16. Next, let's talk about hypertensive crisis, which requires immediate clinical attention and is coded under the I-16 category. Hypertensive crisis includes three specific code options depending on the severity and documentation. I-16.0 is used for a hypertensive urgency, where blood pressure is extremely high but without acute organ damage. I-16.1 is for a hypertensive emergency, a life-threatening condition where severe blood pressure elevation is causing organ damage, such as encephalopathy, stroke, kidney injury, or heart failure. When the documentation simply states hypertensive crisis without specifying urgency or emergency, we assign I-16.9, hypertensive crisis, unspecified. Always pay close attention to terms like end organ damage because they help you distinguish urgency from emergency, and selecting the correct I-16 code is critical for accurate reporting. Overview of O codes for hypertension in pregnancy. Now let's move on to hypertension during pregnancy. In ICD-10, hypertension in pregnancy is never coded with I codes. Instead, we use the O10 to O16 series, which covers all hypertensive disorders occurring during pregnancy, childbirth, or the postpartum period. O10 is used for pre-existing hypertension in pregnancy. O11 is pre-existing hypertension with superimposed preeclampsia, O12 covers gestational edema and proteinuria. O13 is for gestational hypertension without proteinuria. O14 includes all levels of preeclampsia, whether mild, moderate, or severe. O15 is for eclampsia, a serious seizure-associated condition. And O16 is used for unspecified maternal hypertension when documentation isn't clear. And here's the golden rule for pregnancy coding. Always add the weeks of gestation using Z3A codes. This completes the clinical picture and ensures accurate reporting. Before we move into diabetes coding, let's wrap up everything we've learned about hypertension ICD-10 codes with a quick master summary. I-10, essential hypertension. Use this when hypertension is documented alone, no heart disease, no CKD, and no hypertensive crisis. I-11, hypertensive heart disease. Used when hypertension is linked with heart disease. If heart failure is present, assign I-11.0 and code the specific heart failure separately. If not, use I-11.9. I-12, hypertensive CKD. Choose I-12 when hypertension and CKD are both documented. Stage 5, or ESRD, goes to I-12.0. Stages 1 through 4, or unspecified, goes to I-12.9. I-13, hypertensive heart and CKD combination. Select these codes when both hypertensive heart disease and hypertensive CKD are present. Choose the correct I-13 code based on whether heart failure is present and the CKD stage. I-15, secondary hypertension. Used only when hypertension is caused by another condition, such as renal artery stenosis or endocrine disorders. Always code the underlying cause first. I-16, hypertensive crisis. These are urgency, emergency, and unspecified hypertensive crisis situations. Accurate documentation of severity is essential. O10 through O16, hypertension in pregnancy. These codes cover pre-existing HTN, gestational HTN, preeclampsia, and eclampsia. Remember, during pregnancy, O codes always take priority, and you must add the gestational week using Z3A.XX. So that completes our Hypertension Masterclass. Now that you've mastered the foundational ICD-10 rules, let's move into the next major topic, diabetes coding guidelines, another essential skill for every medical coder. Welcome to the Diabetes Coding Guidelines section of our ICD-10 Masterclass. In this module, we'll simplify one of the most commonly coded yet misunderstood areas, diabetes mellitus, coded from E08 to E13. You'll learn how to select the correct category, identify complications, apply the combination coding rules, and avoid the most frequent coding mistakes. Let's begin. Let's take a clear and structured look at the ICD-10 diabetes coding categories, ranging from E08 to E13. This slide gives you a simple overview of the major diabetes types and how ICD-10 assigns codes based on their causes and characteristics. Type 1 diabetes, E10. Type 1 diabetes occurs due to autoimmune destruction of beta cells, leading to absolute insulin deficiency. These patients require lifelong insulin therapy, and the condition is often diagnosed in childhood or adolescence. All type 1 diabetes codes fall under E10, written as E10.X, depending on complications. Type 2 diabetes, E11. Next is type 2 diabetes, coded as E11. This is caused by insulin resistance and a relative insulin deficiency with progressive decline of beta cell function. It's commonly associated with obesity, inactivity, and genetics. Management may include lifestyle changes, oral medications, or insulin. All type 2 diabetes codes fall under E11.X. Secondary diabetes, E08 and E09. Secondary diabetes occurs because of another underlying condition. E08 is used when diabetes is due to conditions like cystic fibrosis or pancreatitis. E09 is used when diabetes is drug-induced, such as from steroids or chemotherapy. These codes always require documentation of the underlying cause or drug, and are written as E08.X or E09.X. Other specified diabetes, E13. Finally, the E13 category covers less common forms of diabetes, such as genetic defects in beta cell function, for example MODY, genetic defects in insulin action, diseases of the exocrine pancreas, and endocrine disorders like Cushing's syndrome. These codes fall under E13.X. This overview helps coders identify the correct diabetes category by understanding the cause, physiology, and clinical characteristics behind each code group. Now let's break down how ICD-10 diabetes codes are actually built. Every diabetes code follows a three-part structure, and once you understand this, coding becomes much easier. First, we start with the category, which tells us the type of diabetes. Here, the category is E11, which represents type 2 diabetes. Next, we move to the etiology, shown in the middle box. This is where ICD-10 adds the extension .2, meaning with, indicating that the diabetes has an associated condition. Finally, we add the manifestation, the specific complication caused by diabetes. In this example, the manifestation coded is 1, diabetic nephropathy. When you put all three parts together, category to etiology to manifestation, you get the complete diabetes code E11.21. So remember, type of diabetes, with, and the specific complication. That's the formula behind every diabetes combination code. This slide summarizes the major complications associated with diabetes, complications that coders must recognize and code accurately. First, kidney complications, also known as diabetic nephropathy. Diabetes can damage the kidney's filtering system, leading to kidney failure and dialysis. Next, eye complications, or diabetic retinopathy. These include vision loss, cataracts, glaucoma, and eventual blindness if left untreated. To the right, we have neuropathy, nerve damage caused by high blood sugar. Patients may experience numbness, pain, weakness, or digestive issues due to autonomic nerve involvement. On the lower left is circulation problems. Poor blood flow can lead to heart disease, stroke, slow wound healing, and even amputations. In the center bottom, we see skin complications, such as infections, ulcers, dry skin, and itching, all common in poorly controlled diabetes. And finally, other organs can also be affected: the brain, heart, and stomach. Patients may experience cognitive decline, heart attacks, or gastroparesis. Together, these complications highlight why accurate diabetes coding is so important. It reflects the true severity of the patient's condition. Now, let's begin with type 1 diabetes mellitus, coded under E10 in ICD-10-CM. Type 1 diabetes is an autoimmune condition in which the body attacks and destroys the insulin-producing beta cells in the pancreas. As a result, the patient has absolute insulin deficiency, meaning they cannot survive without lifelong insulin therapy. This type of diabetes is most commonly diagnosed in childhood or adolescence. Type 1 diabetes always falls under the E10 category. So, whenever documentation clearly states type 1 diabetes, or terms like juvenile diabetes, autoimmune diabetes, or insulin-dependent diabetes with confirmed autoimmune origin, your default ICD-10 code category is E10.X. This code category lays the foundation for adding specific manifestations, such as nephropathy, neuropathy, or retinopathy as needed. Now let's look at type 2 diabetes mellitus, coded under E11 in ICD-10. Type 2 diabetes is the most common form, and it is strongly associated with lifestyle factors, genetics, obesity, and physical inactivity. It is also a default code. When the document says only diabetes, then we code it as E11. Whenever the provider documents type 2 diabetes with or without complications, you'll code from the E11.X series, choosing the correct fourth and fifth characters based on the manifestations documented. So remember, E11 is the core category for type 2 diabetes and its related complications. Diabetic kidney disease, coded as E11.2X. To assign this code correctly, 3 key requirements must be met. First, the patient must have both diabetes and chronic kidney disease. Second, always add the CKD stage using the N18 series codes. And third, if the patient is on dialysis, include Z99.2 to capture the dialysis dependence. Diabetic kidney disease, E11.2X. Make every code complete, accurate, and compliant. Diabetic eye disease, coded as E11.3X. This category includes multiple diabetes-related eye complications. It covers diabetic retinopathy, macular edema, and in severe cases, diabetic blindness. Remember, E11.3X captures the full spectrum of diabetic ocular damage. Accurate coding ensures complete and compliant documentation. Diabetic neuropathy, coded as E11.4X. This category captures nerve damage caused by diabetes and includes 3 major types. Polyneuropathy, coded as E11.42, the most common form, affecting multiple peripheral nerves. Amyotrophy, coded as E11.44, leading to muscle weakness and wasting, often in the thighs and hips. And autonomic neuropathy, coded as E11.43, impacting involuntary body functions such as the heart, lungs, digestion, and more. E11.4X, your complete code set for diabetes-related nerve complications. Diabetic circulatory complications, coded under E11.5X. This category includes key vascular issues linked to diabetes. Peripheral angiopathy, often referred to as PAD, reduced blood flow to the limbs. Gangrene, a severe, limb-threatening consequence of poor circulation. And diabetic ulcers, where coding must always specify the site and the depth of the wound. E11.5X, capturing the full spectrum of circulatory complications in diabetes. E11.4X, your complete code set for diabetes-related nerve complications. Diabetic skin complications, coded under E11.6X. This category includes a wide range of skin conditions caused by diabetes. Dermatitis, inflammation, irritation, and diabetic-related skin changes. Infections, bacterial, fungal, or mixed infections that occur more easily in diabetes. and foot ulcers, requiring additional coding using L97.X to identify the ulcer's site and severity. E11.6X, your complete code range for diabetes-related skin complications. Other and unspecified diabetes codes, covering the remaining categories in the E11 series. E11.8, Complications NEC. This code is used when the patient has diabetes-related complication that doesn't fit into any other specific category. And E11.9, Diabetes without complications, used when the patient has type 2 diabetes with no documented complications. E11.8 and E11.9, the catch-all codes for diabetes when details are limited or unspecified. Medication coding for diabetes includes several important Z codes. Z79.4, long-term insulin use. Use this when the patient is on continuous or maintenance insulin therapy. Z79.84, oral hypoglycemics, assigned for long-term use of oral diabetes medications. And Z79.85, GLP-1 therapy, used when the patient is maintained on GLP-1 receptor agonists. These Z codes support accurate and complete documentation of diabetes medication management. ICD-10 code E11.9, Type 2 diabetes mellitus without complications. This is the code you'll use when the provider documents T2DM, DM2, or simply type 2 diabetes, and there are no complications like neuropathy, nephropathy, retinopathy, or circulatory issues mentioned. Always remember, if the chart does not specify any complication and does not link diabetes to another condition, E11.9 is your safest, most accurate code. Let's look at an important diabetes code. E11.65, which stands for Type 2 Diabetes Mellitus with Hyperglycemia. You should use this code whenever the documentation shows elevated blood sugar, poor glycemic control, blood sugar spikes, or terms like hyperglycemia in a patient with type 2 diabetes. Remember, this code captures the idea that the patient's diabetes is not well controlled, even if the provider doesn't use those exact words. So anytime the chart clearly links type 2 diabetes with high blood sugar levels, E11.65 is the accurate and specific code. Let's break down hypoglycemia coding in a simple way. When a patient with type 2 diabetes has hypoglycemia and the provider doesn't specify further details, we use E11.649, type 2 hypoglycemia, unspecified. But if the patient has type 1 diabetes and hypoglycemia with coma, the correct code is E10.641. Always match the code to the diabetes type and check if coma is documented, because that changes the code completely. Think of it like the neon icons here. Low battery equals hypoglycemia, and the falling cube signals severity. Stay alert to documentation details. They make all the difference in coding accuracy. Diabetes coding quick flow. Start with identifying the type of diabetes. For type 1 diabetes, assign E10.X. For type 2 diabetes, assign E11.X. And for secondary diabetes, use E08 or E09 depending on the underlying cause. Once the diabetes type is chosen, move to the specific complication: kidney complications, eye complications, nerve complications, and foot complications. Each pathway links directly to the appropriate subclassification to ensure precise and complete diabetes coding. Diabetes Coding Quick Flow, your fast guide to choosing the correct ICD-10 code. Thank you for watching this Diabetes Coding Masterclass. If you want more beginner-friendly ICD-10, CPT, and EM training, make sure to subscribe to Coding Doctor, your helper in medical coding. Now we will move over to Z-Codes Masterclass. All right, coders, let's supercharge your Z-code knowledge. Here are the common Z-codes you'll use every single day in clinical documentation. Z0 to Z13, that's your zone for exams, screening, and preventative visits. Super common. Z20 to Z29, think exposure and prophylaxis, like exposure to viruses. Z30 to Z39 covers reproductive care, while Z53 reminds you when a procedure isn't done. Z55 to Z65, huge category, social determinants of health. Don't skip these. Z68 is your BMI code, always secondary. Z79 is your powerhouse for long-term medication therapy. Insulin, oral hypoglycemics, steroids, anticoagulants, and more. Finally, Z80 to Z87, that's family and personal history. Master these and your coding speed and accuracy will explode. Let's keep going. Let's start at the top. Z00 to Z13 codes are your bread and butter for screening and preventative care. Annual wellness visit, screening for anemia, screening for depression, pediatric routine exams. Whenever the provider is not diagnosing a problem, but simply checking for one, this is the zone. Please have a look at commonly used codes of this category. Next up, Z20 to Z29, the exposure group. This is where you code situations like exposure to viruses, contact with infectious diseases, prophylactic vaccinations, preventive antiviral or antibiotic therapy. A common example, Z20.828, exposure to a virus, widely used in OPD settings. Please have a look at commonly used codes of this category. Moving on. Z30 to Z39 is all about pregnancy prevention, family planning, and postpartum care. You'll use these for contraceptive counseling, IUD insertion follow-up, routine obstetrics care, and postpartum visits. These are very high yield in OB/GYN and family medicine coding. Please have a look at commonly used codes of this category. This is a small but powerful code. Z53 is used when a planned procedure was not carried out. Examples include surgery canceled due to patient illness, blood test not performed because patient refused, and procedure postponed due to equipment issues. Document why it was not done. That determines the right Z53 code. Please have a look at commonly used codes of this category. Now, this is a very important category in value-based care. Z55 to Z65 codes capture social factors affecting health. Examples include homelessness, financial insecurity, educational challenges, family problems, occupational risks. These codes influence reimbursement, risk adjustment, and quality metrics, so coders must recognize them. Please have a look at commonly used codes of this category. Z68 is your BMI code, and here's the most important rule. BMI is always a secondary code. You never code BMI alone. It must follow a related diagnosis like obesity, malnutrition, or weight management counseling. These are commonly used codes for this category. Now, this is a high-yield category for diabetic and hypertensive patients. Examples include Z79.4, long-term insulin use, Z79.84, long-term oral hypoglycemics, Z79.01, long-term anticoagulation therapy, Z79.899, other long-term drug therapy. Use Z79 codes when the provider documents chronic use or medication is taken continuously for a condition, not for short-term or acute prescriptions. These are commonly used codes for this category. Finally, Z80 to Z87 codes capture a patient's past history or family history of diseases. Family history of cancer, past history of myocardial infarction, history of asthma, history of fractures. These do not reflect current illness. They provide context for risks and follow-up care. These are commonly used codes for this category. All right, coders, let's wrap this up with your ultimate Z-code master summary. At the top of your screen, we've got Z00 to Z13, screening and preventative visits. These are your wellness exams, routine checkups, and all your screening encounters. No symptoms? No complaints? You're here. Next, Z20 to Z29, exposure codes. Think exposure to virus, contact with disease, and of course, the legendary Z23 for immunizations. If the patient walked in because they were exposed, this is your zone. Slide down to Z30 to Z39, reproductive care. Family planning, prenatal visits, postpartum care, it's all covered right here. If the visit involves pregnancy or contraception, boom, you're in the Z30s. Moving over, Z53, procedure not done. Canceled surgery? Patient refused? Contraindication? Don't skip it, code it with Z53. Now, one of the most important categories today, Z55 to Z65, social determinants of health codes. Housing issues, financial stress, education barriers, the real-life factors affecting patient care. These matter. These impact outcomes. And yes, these are codable. Next up, Z68 BMI codes. Remember, BMI is always secondary. You never code it alone. Then we have Z79 long-term drug therapy. Insulin, hypoglycemics, anticoagulants, steroids. If the medication is long-term or chronic, Z79 has your back. And finally, Z80 to Z87, family and personal history. Past cancers, past diseases, family history risks. These codes tell the patient's story. This entire screen, this is your Z-code roadmap. Master these categories and you will level up your clinical coding accuracy instantly. Hey coders, if you're ready to master ICD-10, CPT, and real-world medical coding the fun way, you're in the right place. Hit that subscribe button and join the Coding Doctor family for powerful tutorials, smart shortcuts, and masterclasses that make coding feel easy. Level up your skills, boost your confidence, and let's code smarter, not harder. Subscribe now, and let's begin your coding transformation. This is Coding Doctor, and I'll see you in the next masterclass. Until then, keep learning, keep coding, and keep growing.